Hey, Seawolf community, Chancellor Sandine here with another segment of Ask a UAA Expert. Take a look.
So my name is Amana Mbise. I'm a postdoctoral fellow in the School of Social Work, College of Health, and I'm here to talk about how we can support families in times of crisis through a social work perspective. How do we support families in times of a crisis? One of the things that I've gathered from speaking to a lot of people and families is the fear that they have with the current crisis with COVID-19. Fear about the health of their loved ones, the fear about their own health, but also the fear around the uncertainty of what's to come in the future. And one of the ways that we can help to address the fears is, multiple ways, but one I think is the being able to provide accurate information. And I feel us as social workers have that responsibility to share accurate information in addition to all the information that's been provided on how people can stay safe, but also reassure our clients and the families that we work with about this is not the end of things. We have to encourage and give hope as well as support. The next thing that we can do for our families is to listen. A lot of the information that's coming out right now is coming at us. We get information from the health department. We get information from above. If you open your email, you get a flurry of emails about what to do during this crisis. So there's an overwhelming amount of information that's coming at us. And perhaps this time is a better time for us to listen, to offer the ear, and for some of the people who are at a higher risk for this virus are actually people whose spaces for getting heard are getting minimized and are not able to speak out. And I think we can help a lot if we are the ear to help and listen. And so that's really a critical thing that we can do to offer an ear for many of the people that are struggling right now. So the third thing that we can help is to talk to the people that we're working with. A lot of the people who have been impacted by the virus are already the ones that are at a higher risk of being isolated. And they're not hearing any other news or people who are just having ordinary conversations with them. And I think we can do that. As social workers, we can help to have normal conversations with the different people who are experiencing isolation right now. And I know of programs where in the local community, for instance, they have decided that they'll take a list of their members and call them and share these numbers to some of their members, and you can randomly call and have ordinary conversations other than about the virus. So I think that's really important at this time where we can kind of try to have some sense of normalcy of having ordinary conversations with some of the people that are really struggling right now and not even having the ordinary spaces, which were kind of the spaces where they had normal conversations other than COVID. And the fourth thing that we can do is really to help families be able to weigh the balance between the private interests as well as the public good. And what I mean by that is there are a lot of families that would want to maintain the same relationship, the same kind of contact that they've had with their family members. But being very honest and open to them right now and say, there's certain things that are going to change. If you want to go and visit your grandparents, for instance, that might have to perhaps shift to an online format. You can say, grandpa, grandfather, grandmother, I would really like to, but we cannot be able to have the same space and kind of interaction that we have had. And maybe try to have a FaceTime, for instance, if they can, or maybe call. And so you would realize that you're able to kind of balance the benefit of interacting with your grandparents, but also really considering the risk that you might be placing on their health. And so helping family members to be able to weigh the costs and sort of the benefits of continuing with the normal interactions, as well as the impact that we might have, the things that we've done on a normal basis, some of those practices, the impact they might have on the health of our loved ones. When we're thinking about all this is also to remember that different families have different needs. And so, for instance, I'm aware of families that are right now thinking about, I have to educate kids, from home. But let's think about a family that, one, they're probably immigrant family, and they're not able to, speak English well enough and be able to support their kids. Or, for instance, they have challenges with the internet, with access to technology. We also have to think about sort of the unique needs of these families. And I have been able to interact with some of these families which are now asking, how do I support my child? When I have limited language abilities, not being able to speak English, how do I get a laptop? Because we don't have a laptop. And so most of these kids depended on their school or the local library to get their homework done. And so we have to think about these different families and the different needs that come into play, especially when we're trying to reach out to these families. And most of the impact actually will fall on families that are already highly marginalized and isolated. And we have to really think about those families and how to ensure that their needs are uniquely addressed as well.